That's the psychology of that. I don't care what anyone tells you. You will use the hand that your body prefers. Now, you're going to find the experience of opening up these little hermetically sealed envelopes. There's another 10 seconds, right? So open this guy up. Please don't open them up before you have to. That is called cheating. Right? Now, for sanitary purposes, we have fresh lungs. You can tell because these have not been opened. Okay? We do not use recycled lungs, just for those in case. Environmentalists. All right, you're gonna push your hole in just to open them up. You're gonna give yourself a few extra seconds for this, okay? This is not part of the training. Just open it up. And then the shield with the text at the bottom, the face makes it self-explanatory, right? Nice and easy. Just place the one barrier. Why do we have this? Why do we have a barrier?
So you don't get any infection or
Exactly.
disease.
Why do we tilt? Yep. And why do we tilt the head back? The air, right? And also, when you do blow in, there might be bile, might be liquids coming back up. You just don't want it in your mouth. For the adult and the child, we're taking the head all the way back. For an infant, what does it tell you? What's the description? Neutral. Now, are we driving a car here? Right? Does neutral explain where the head should be to you guys? It does? It does? Okay, where would you say, if someone...
Neutral would be normal, how the head is.
Not all the way back, but neutral is normal. Do you guys...
It wasn't clear to me.
Okay, how do you guys feel about neutral? Seriously. Come on, neutral.
So then
No
you
means
wouldn't
what?
tilt it at all, right?
Sorry?
If it's neutral, you wouldn't really tilt.
Okay, but where would you place it then?
Whatever it is.
Would you put, in other words, is
No.
neutral chin on chest?
No.
Is neutral 1 inch from chest? Is neutral 2 inches from chest? Obviously, it's not all the way back because that's what we do with adults. But my point is it clear? Is neutral absolutely clear?
Yes.
It is to you? Is that because you've done it?
No, because I believe neutral kind of like normal. So when it's normal, you can be receiving. When it's blocked, then you not receive. When I up, then you not receive. Neutral, you can receive.
Okay, so for this lady, that explanation works. What I've found is if I say to someone, have the head, the chin, horizontal with the chest, that's neutral. See the difference? It's not right or wrong, it's getting the results you need through understanding. So that's okay. I don't see what I said about I need your input, because if I tell you what I think, then the video has another way, and your experiences are different. Now you've got 3 different ways. And we haven't got clarification. And that's important. That is the 10 seconds where we could lose, okay? For how long do we apply our breaths?
1 second.
1 second. For an adult, it's a full breath, right? For a child, what do you think? Child, adolescent.
Normal.
Normal. What about an infant? Infant. Do you think their cavity, their lung cavity, can take as much breath? Right. So you'll breathe a little less, observe the chest, see if it's rising, and then go again. Okay? So you do your 30 breaths, 30 compressions, 2 breaths. When you finish the second set, you'll then look up, and whoever your partner is, you'll say, Sydney, I need you to get the AED. Sydney might do one of these in reality. Me? No, I'm not going to get involved. But you've identified her or him. If that person doesn't want to do it, then you turn and say, Connie, please get an AED. Okay? In the meantime, you can also be speaking to your cell phones to call emergency services. You don't have to call someone out of the crowd to call emergency services. That's my point. Okay? Then they'll set up the AEDs, which are in those black bags. You'll be in your second set of compressions and breaths. That's where the communication comes in. That's where those 10 seconds comes in. So here's a question. Does it matter which pad goes where on the body.
Usually it's a picture.
Upper
Right? So usually there's a picture.
right. It goes like this.
Alright.
Upper right.
So how would you describe that to someone? How would you instruct somebody? How would you instruct somebody to place the pads? How would you instruct somebody?
Upper right, lower left, under the left.
How about lower left on the client, upper right on the client? Because if you say left and right and the other person interprets it on themselves, or the fact that they're looking at you, see how it can get a little complicated? And it's happened, that's why I'm saying this. I'm not saying it because I just want to be difficult. I'm saying it because EMS people and some emergency responders have told us this. So to be precise, we say of the patient, left bottom side of the patient, top right side of the patient. See how it's very clear? Does it matter which pad goes where? Does it matter which pad goes where and why?
It's the same current in each pad.
Right, exactly. It's not a current running through a closed system. These are closed systems. This is just a jolt. Can you use the AED with someone with a pacemaker? Yes, we just spoke about it. Because the AED is going to listen to the pacemaker, and as long as it's working, no shock is advised. If it's not working properly, shock is advised. That information then goes back to EMS when they come plug their unit into your CPR, into your AED. Okay? So once you've done that, then we'll go into doing infants, and then we'll go into choking. Okay? Grab your partners, you decide who you're going to work with, and